Good evening and welcome to our In Focus discussion. In the days leading up to Pride Week in June, we're discussing different topics that impact the LGBTQ+ community. Tonight, we are talking about trans and non-binary health. To this day, some trans and non-binary people still face difficulties and have challenges in accessing gender-affirming health care. We'll hear from someone sharing their personal perspective and two local professionals on what they're doing to improve this issue. Now, joining us first is Addison Hemmert. She's a transgender woman who's a patient at the Rebirth Gender Center, and she's also our morning video editor here at ABC4 News. So, Addison, thanks for joining us and being on this side of the production.
Thank you. I'm happy to be here. This is a very unique experience.
All right, well, let's get into this a little bit.
Okay.
And I want you to take this at your own comfort level, okay? What can you tell me about your transition story?
Well, like with a lot of other trans individuals, I knew at a young age, but I also didn't have the words or language for it when I was that young. And it wasn't until later in life when I discovered what it was that I was dealing with that enabled me to ultimately take the steps to become who I always felt like I was inside. It wasn't easy, but it was very worth it.
Okay, so, you know, help our audience understand when you ultimately had that decision to come out, and what are the factors that led up to that decision?
Well, it was a lot of self-reflecting, a lot of, was I happy with where I was in life, with who I was? I was hiding a lot of who I was as a person, and that made me miserable. And ultimately choosing to come out allowed me to just open up. I was very introverted before I came out, and after I came out, it flipped a switch, and I love hanging around other people. I became more of who I felt inside, and that was huge. It was a shock to some people. You know, I have support with a lot of family members. Some not so much, but they're learning. They're growing.
Well, we're all learning. I'm learning here too. You've taught me a lot. You know, Rosie's taught me a lot too. So, you know, based on your experience or what you've heard from others, what are the challenges or barriers that can exist when someone comes to trans health?
Well, I think the biggest barriers that that can occur and that I've seen personally is employer providing benefits, for one. Cost is a huge thing when it comes to trans healthcare. That's why it's so important for places like Rebirth, where I went, to exist. And I'm grateful that they were there.
Yeah.
It allowed me to get the care that I needed. And one of the next guests who will be on, she was so phenomenal and wonderful with me when I sat down with her. And like I said earlier, it allowed me to open up and become the person I am today.
Well, we appreciate you, and we want to talk about, you know, you received some medical services from the Birth Gender Center here in Salt Lake City, which we'll hear from them in just a little bit. You just kind of alluded to that whole thing, but what did it mean to you to have a place to go to that was uniquely positioned to really serve the trans and non-binary community?
It was wonderful. I came across them just looking for a place to go when I knew when I had come out. But I didn't have a place to go at first. And when I came across them, set an appointment up with them, and I was able to go and meet with Rixt, and it was just phenomenal to have that place. And you know, I know there are others out there that are looking for places to offer those services. And Rebirth was, I mean, phenomenal. And I love the staff there. They're really hands-on, and I don't know what more to say. It's great to have them available.
Well, that's really good to hear. So what would your message be to other trans people who may have experienced some of these similar barriers, difficulties, discrimination, or any type of challenge when pursuing this medical care in relation to their mental and physical health?
I would say if they are in a safe place to speak up, do so. I know there are trans people that can't speak up. And, you know, if you are in a place, if you have come out, but you are looking for a way to be able to afford the necessary care, speak up. Speak up to our legislature, speak up to our employers. Do what it takes to let them know how important this health care is. That's probably the biggest thing I can say.
Well, thank you, Addison, for coming on tonight. You've all been hearing from Addison Hemmert, a transgender woman and patient at the Rebirth Gender Center. She is also our morning video editor at ABC News, so we'll be seeing her again on Monday morning. But Addison, thank you for being here and sharing your story with us.
Thank you. I really enjoyed my time here.
Thanks for staying with us with our second In Focus discussion tonight on trans and non-binary health. We turn now to two local professionals in this field of medical and psychological health care. Sorry about that. Rick Lukinar is the founder of Rebirth Gender Center, and Kimberly Anderson, she's over there to the right, is the family and marriage therapist at Flourish Therapy. Ladies, thank you for joining us tonight for this discussion.
You're welcome.
Hello.
Thank you.
How are you?
All right. Well, I'm doing good. I'm hoping that we have a really good, insightful discussion here. Rex, I really want to start with you. Can you tell me a little bit more about the Rebirth Gender Center? Because I don't know very much, and how your practice is actually uniquely positioned to serve the trans and non-binary community.
Yeah, so I founded Rebirth Obstetrics and Gynecology in 2014. I have worked as a gynecologist for now over 20 years now, and had started seeing transgender patients at my clinic, and I wanted to focus more so on this community by itself, and I had figured a private practice for that purpose would serve as well. So we opened in 2014, and so we are a full service in obstetrics and gynecology, but then including the entire transgender community, and do primary preventive care, OBGYN, but also hormone therapy and pre and post-operative care for this community, which includes transgender, but also that is an umbrella term for also non-binary people who feel somewhere between a man and a woman, and that is honestly a group of people that aren't always recognized. So we want to celebrate that group of people, and we want to also take care of them.
Well, thanks for doing that. Kimberly, I'm going to kind of turn the page to you.
Okay.
Let's talk about Flourish Therapy and how your clinic serves the trans and non-binary community.
Thank you. Flourish Therapy was founded by Dr. Lisa Tensmeyer Hansen. She's my supervisor. We serve the LGBTQIA+ community here in Salt Lake, all over Utah, and actually have many, many clients in the Intermountain West and beyond. We are positioned uniquely in that we focus on LGBTQIA population, Many of our clinicians identify as either queer or trans or non-binary, and we do continual training inside the group, and also we receive external training outward, looking outward to make sure that we are both humble and contemporaneous to what's going on with best practices in the mental health world.
Wow, thank you for that. I've been getting my own humble pie here, so.
It tastes so yummy, yeah.
Yeah. Well, Rex, I want to go back to you here, and you kind of hinted towards your professional experience here. So can you tell us about the special training that you've had regarding trans and non-binary healthcare?
Yes, so I'm a board certified obstetrician gynecologist with a focus on pediatric gynecology. But during my residency, when I spent a month in the Netherlands doing sexuality and psychosocial gynecology, I actually worked with a physician that did transgender healthcare, which was in 2003. So that was my first connection to the community. I found it intriguing at that time, and as I worked for the University of Utah for 10 years, I felt there was a need in Utah to reach out to the transgender community, and I actually spent several weeks in Amsterdam with the gender team at the University of Amsterdam, or the Free University of Amsterdam, who has treated transgender and non-binary people since the 1980s. They're also really well known for puberty blockers and treating children at as soon as puberty hits. So I spent time with a gynecologist there who ran that entire team, so I got to spend, I got to learn everything from hormones to mental health care to pre and post-op care and see how they worked as a team. So I took that information to my clinic at that time, and then also connected to the World Professional Association for Transgender Healthcare, who create the standards of care. So these are like kind of the guidelines for transgender healthcare. I spent time at their conferences. I also became certified through them by doing several trainings, going to conferences, and then since 2014, we now have taken care of at least 5,500 transgender and gender non-binary people. And that includes hormone therapy, primary preventive care, but also preoperative and postoperative care. I've also performed surgeries like hysterectomy and orchiectomy for patients, and guide patients that go out of state for larger surgeries and then come back and do postoperative care for them as well.
All right. Well, Kimberly, I've got about a minute left here in this segment, so I really want to get to you. I know you're a well-known therapist in the area, but what was your passion? Where did that come from to get into all of this?
Well, so I am a transgender woman myself, and having a unique history and background here in Utah, was raised LDS, and know the unique formula of concerns here in the state. I actually went to the University of San Francisco, and I'm part of some work groups there focusing on transgender mental health. I moved back to Salt Lake in July of last year, specifically to work with Flourish and especially to work at the Rebirth Health Center with Dr. Lucanar. So my passion comes from me being part of the community that I serve and work with.
All right. Well, I want you two ladies to sit right there, hold your thoughts, because we have to take a quick commercial break. But when we return, we'll resume our In Focus discussion on trans and non-binary health. Welcome to our third and final In Focus discussion tonight on trans and non-binary health. Before we went to break, we were joined by Rex Lucanar, and who's the founder of the Rebirth Gender Center, and Kimberly Anderson. She's a marriage and family she's at marriage and family therapy, no, I'm screwing it all up, Kimberly. You're a therapist at Flourish Therapy. We're gonna just pick this right up here. I'm so sorry about that.
Great.
All right, well, Kimberly and Rex, let's talk about the wraparound approach to healthcare, because that's a big issue. Could you explain what that means and why it's important to integrate mental and physical care all at the same time?
Do you want me to take that?
Yeah.
Wraparound care is a unique phrase where we kind of try to figure out as many different systems that we can put in place in one location at the same time, so the clients or the patients don't have to go to a lot of different locations. Wraparound care, as far as Rebirth is concerned, we have electrolysis there. Dr. Lucanar can see clients through all stages of their medical transition. My office through Flourish Therapy is actually located 3 doors down from Dr. Lucanar. We coordinate patient care and have conversations. I ask her about best practices regarding hormone therapy or latest in surgical practices, as my clients might be asking about them in session. I can't give medical advice, but I can refer to the expert that her office is 2 doors down. I often go down and bug her and ask her about specific things. So we really try and have a team approach there at Rebirth and make sure that the clients can get everything that they need in one place.
Oh, Rex, do you want to chime in? Do you want to tell us where your side of this whole wraparound approach is?
Yeah, so 70% of people who identify as transgender or non-binary struggle with their mental health. So these are things like depression, anxiety, suicidal ideation, eating disorders, and a lot of them are on the autism spectrum. So these require, a collaboration with a therapist. And I don't think a therapist is mandated for a start of, for example, hormone therapy, or not even for requiring, requesting surgical, options, but I think it's the combination that matters, right? So pillars of a transition is social, legal, medical, surgical, and mental, and those should all be be connected, that if a person comes to ask for a transition, that you ask them, okay, what's your wish list and what do we need to do to make this a good experience for you, and who's your support system, and yeah, if you need a therapist, who do you see for therapy? And having that connection with Kimberly and being able to talk about a patient who needs like emergency care or is feeling suicidal or is having some struggle is actually really nice, because then we are always able to reach out and help the patient out when we need to.
Sounds like you guys got a nice building where everybody can get what they need out of it. So, Kimberly, let's talk about something else here, because I understand that both of you are hosting a trans non-binary clothing drive. Can you tell us why there's a need and how people can help that?
Absolutely. So many of my clients come to me at the very beginning of their transition, and they may have never been out to buy clothing that is appropriate for the gender presentation that they would like to give. And one of the things that prohibits them from going out and having those first steps of a social transition is, what do I wear? And so what I've been doing is asking some of my friends from TikTok and the local community, bring by clothes. So far I've gotten like 10 giant grocery or garbage bags full of clothing. We've got them kind of sorted by randomness, really, in different piles in my office next to mine. And so my clients come in, and it's just so amazing to watch the giddiness and their expression, the laughter in their voice, really just having a chance to, free of charge first of all, but really free of shame and guilt, look and select clothing that really is appropriate for how they want the world to see them. It's been really amazing.
Well, I understand that you're both helping continue educate folks like myself and others, and there's a lot of training that goes on. Doctor, can you tell me what still needs to be done to help bridge these gaps for the trans and non-binary healthcare?
Oh, there's so much. I think we need to start with seeing each other as normal people and respect one another, and then maybe ask for a name and pronouns and make that a given thing anywhere, and maybe just stop caring so much about whose gender somebody is. I mean, most questionnaires where people ask for gender, the word gender shouldn't even have to be there, because it just makes it so hard. Let's start with having bathrooms that are non-gender, that are for everybody, and do that at schools and workplaces, and make work more inclusive. And indeed, like Addison was saying, let's offer insurance for the transgender community that's inclusive, so that actually their services are covered, the surgeries are covered, and that they can just be the people that they are, or that we are. So it's important.
All right, Kimberly, you get the final word. We got about 30 seconds, maybe 25, my producer's telling me. So anything else that you would like to add so that our viewers can understand this topic a little bit better?
Yes, quickly, to those transgender and gender non-binary people that might be viewing, we see you, you are valid, you are real, you are a valuable part and a needed part of our community, and we want to make sure that we can find you, you can find us, and get the help that you need. To the parents of those individuals, or the families and spouses and partners of them, we know you're afraid, we know you're scared. It's a scary thing to do this. Please support your loved one as much as you can and reach out for help. You don't have to do this alone.
All right, well, you've been hearing from Dr. Rex Lukinar, who's the founder of the Rebirth Gender Center. And Kimberly, I'm going to get this right. This is Kimberly Anderson, a marriage and family therapist at Flourish Therapy. There we go. I didn't butcher it this time. Thank you both for being here tonight and participating in our In Focus discussion.
Thank you, Jason.